So we had to enter in through the Rafah border. So we came in through Egypt, we flew into Cairo and then up through Sinai and across the Rafah border. And there must have been about 300 trucks waiting to go in. And we did see trucks that had obviously been turned back. And one that really sticks with me is that there was a truck, really large lorry full of babies' nappies or diapers. The pallets were all uneven because I presume that they'd been checked or something when they were going in the other direction. And when we asked...
They'd been sent back?
So they'd been sent back at the border. Yeah, that's right.
So these are children's diapers,
yes.
nappies?
Yes.
What about, you're an OBGYN?
Yes.
There are terrible stories of women
Absolutely.
who are giving birth in the street, who, I think there's something like 180 women per day give birth. Apparently 15% of them, I think that's the number, are unlikely to do well.
Yes, that's correct.
Tell me, what is the situation today for women, pregnant women, and the babies they deliver?
There is no antenatal care for women, so women are not getting any care in their pregnancy. Every woman that I did see, I asked her when she was last seen, and it was October. They're not getting... anaemia is a real problem in Gaza anyway. It's about 50% of people are anaemic, even in non-war times. They'd had no supplements, and the women I saw were really severely anaemic. Now, if you are anaemic and you bleed at the time of your birth, you may die because you haven't got the reserves. Women, there's a thing called vulnerable women, and in humanitarian crises, situations, women become especially vulnerable. And that means that they're more likely to miscarry, they're more likely to have stillbirths, they're more likely to deliver prematurely. There are women, in Al-Aqsa, for example, there was a woman who'd had no antenatal care, and in fact she'd arrived the day before I arrived, and the obstetricians, wanted to tell me all about this woman. And she'd arrived fitting, so she was having seizures as a result of a complication of pregnancy called eclampsia. So if you have untreated high blood pressure, it can go on to cause fits. And this woman arrived unconscious, having continuous seizures. She was treated. Her baby was delivered by caesarean section. It was on the neonatal unit. But that woman was then on the intensive care unit with a cerebral hemorrhage as a result of her seizures. And that's the sort of thing that's happening. And that is just one of thousands of stories. Many women can never even reach a hospital to give birth. And that's because they haven't got transport. There is no electricity. It's dangerous. They might be entering, a hospital that is surrounded by conflict, by bombardment. It's not safe for them to move. They can't even call an ambulance because Wi-Fi, you don't have a mobile signal. So they can't summon care.
You've been to Gaza, as you said, many times. The health system there has never been fabulous, but there are a lot of hospitals.
There are a lot of hospitals.
What is the state now? Because we hear the whole health situation is collapsing.
So I think there has been a sort of systematic dismantling, really, of the healthcare system. It's almost like a kind of a fall, really, of, one hospital falls after the other. And healthcare systems, healthcare facilities should be protected. They're there for everybody.